Welcome. I'm Dr. Daria Brzezinski, and you are watching What Wise Women Want here on CPA TV, Charlottesville, Comcast Channel 13. We're here every week with all kinds of wonderful discussions with panels of women. And today we have a very, very, very interesting topic that we're going to try to bring down away from the kind of fluffiness and be a little bit more scientific. And we're talking about bioenergetic healing, which are kind of the subtle energies, and you're going to learn a little bit about that as the time progresses. But I'd like to introduce you to my panel to begin with. And to my left, we have, let's start with Veronica. So at the end here, we have Veronica LaChapelle, and to her, next to her, is Helene Rose Miller. Next to her is Ashley Coleman. And finally, we have Helene Ramos. Each one of you is in a unique position because you are doing something that's out of the allopathic boundaries and pretty unique to most people, even though some of you have degrees in traditional kinds of medical backgrounds and things like that. So just to give us a little bit of an idea, does anybody want to give us a definition of what energy medicine, bioenergetic medicine is, or healing is, so that people, before we even start, so that people know exactly what we're talking about? So for me, when I think about it, I think of, for example, the light spectrum. And the light spectrum is huge, what we know of it so far. And virtually a pinprick of it is the only thing we can see with our naked eye. There are microwaves we can't see. There's things we can't see with a microscope, a telescope. So all the things, all the energy in the universe is not necessarily seen by the naked eye. And if we do the typical definition of energy, energy can be, from our science lessons in school, energy can be created or destroyed, but cannot be, but can be changed from one form to another. So what does that mean in terms of reality and healing and all that? Who'd like to start? Anybody? Nobody? Definition of energy.
It's a big topic, isn't it?
Okay, go ahead.
So energy can take a lot of forms. The way I work with energy is it's the energy fields and the energy information that is surrounding the body or surrounding objects.
Okay.
And kind of receiving that information and using myself as the translator for what that information is. So like what you said with the light spectrum, energy that I work with isn't seen with the naked eye, with the regular senses, but it can be felt or perceived with training and exposure and experience.
Okay. Anybody else want to talk about energy?
Well, just to add to that, in my practice, I use instruments to measure those energy fields.
Okay.
Yeah, it's two different instruments, actually.
Okay.
So we can actually measure the body field as it goes out, the energetic field that many of us can't see, some can see. And we can also measure the energy that's around a cell and in a cell with my instruments. Then we can make corrections if there's distortions in those fields.
Okay, so if you can see energy or some instrument picks up energy. Now, you know, I've experienced a lot of these different technologies. I've experimented all over the place. Every time a new one comes out, I try it. And like I've done Kirlian photography, for example, which takes a picture of the energy from 8 to 10 feet outside of your body. And apparently showed at that time of my life, which was not a very good one, you know, all these gaps in between. And so that kind of showed the energy that was going on in my body at the time. And but you know, when we talk about the technologies that are available that picture this, I mean, how is the energy you're talking about different than let's say an X-ray or we've got all these instruments that take the internal parts of the body. You guys seem to be talking about external kinds of energy. So how does that work in your business? Want to talk about that?
Sure. I see energy as the blueprint to physical experience. And when somebody wants to shift something about their lives, whether that's a thought, an emotion, or they keep creating the same thing again and again, I believe and I work in the energetic field. So that is the root, right? So we try to change things on all these different levels, whether that's physical symptoms, emotional, but when you access the energy, you're accessing the root cause of the discordance. Energy is there prior to physicality. So when there's physical symptoms, that's usually the last to show up. It's the densest part of our existence.
Okay.
So we can create healing on the energetic level, which then trickles into all other parts of the self.
Okay.
On a very simplistic way of seeing, first of all, we're using the word see. And it isn't just that we see. It's important to include the fact that we receive information in many different ways. It's just easier in conversation to use the word see. So she might sense an energy field or a distortion or something in a different way than I might. But we're going to, for the conversation, use the word see. And so to build on what Ellen was describing, but in a very kind of simplistic way, the energy, all we are is energy. That's it. That's all that's the end of the story. We are energy. Where it is, we're like an electrical system where there might be a break, a distortion, a congestion in that electrical system. And it's part of our job to detect where that is, and also very important to have a sense of the underlying.
Okay.
This is why collaborative medicine is so important. An allopathic physician might be a very helpful person on your team when you're on a healing journey, right? And how we may assist that is we might go that next level, as Ashley was talking about, because what's really important is getting to the source, getting to the root of that, whether that's trauma, an old injury, something that happened when we were a child, a life transition, whatever that might be.
So just to let people know, allopathic is like traditional medicine versus what we're talking about here, which is, it's not non-traditional because a lot of it is thousands and thousands of years old and just coming to the foreground now. So this is really kind of way out there. So how did you get involved in this? I mean, what led you to decide to do something like this? Veronica, you want to start? I'd like to know that from each one of you.
Well, I was a nurse, and I worked in hospice and managing hospice clinics or sites in Texas. And then I was involved in a very traumatic car accident that no one knows, number one, why I survived, but secondly, why I ever walked. Because I have a spinal cord injury in the thoracic spine. The core of the car was damaged.
Wow.
And I got out of the car, which looked like a tin can, and I heard this voice that said, "Don't get into the ambulance." And so I looked at EMS, who was there to support me, and I said, "I'm not getting into that ambulance." And he goes, "Well, what do you mean? You're severely injured." And I go, "No, I'm not." And I looked at the policeman and I said, "Would you take me home?" And he said, "Sure."
Story.
And so when I got home and I'm sitting in my sofa, I knew at that point, if I had not walked away from that accident, I would have been paralyzed from the chest down. My higher self, or what we call intuition, guided me, and I actually paid attention. And that was the beginning of me knowing that I have a higher self and I need to listen to it.
And how many people never listen to that
That's right.
intuition?
And I've always walked, and that was in 1995.
Wow.
Yeah. And so where that brought me was to leave that nursing career and to move into energy medicine. And then I started studying and studying and attending seminars and classes. And then I realized I had everything I needed right here.
Excellent.
Great story.
Moved from there and had a full clinic in Austin, Texas. I retired. I have a partial clinic here. And then I also train yoga teachers.
And you're a naturopath as well.
I am.
Okay. All right. So,
Remarkable story.
Leena, how about you?
From the time I was, we think 7, I wanted to be a doctor. So I asked Santa Claus for a stethoscope, and he actually came through. I also asked him for a hypodermic needle, and he came through. And you have to understand, this was a glass hypodermic needle,
Wow.
which my brother subsequently put baking soda and salt in and injected all the Christmas oranges, so they were really bitter. And I just always knew that I had some future in something that sounded or seemed like medicine. And yet when it came to college time, I went into early childhood education and psychology and not medicine. So fast forward, I was in my 30s and I was in Connecticut at the time at a yoga class, and my teacher started talking about energy medicine. And it was like, oh, I've waited all these decades to discover that what I was really called to do was not any sort of invasive or intrusive medicine, but more to be a healing partner or a partner on the journey, if you will, which it sounds like we all have very much in common, right? And I was very fortunate because of where I lived at the time. I got to sit with Bernie Siegel at Yale and Herbert Benson at Harvard, and the real pioneers who were bringing in the concept of psychoneuroimmunology, who were talking about body-mind medicine. And these were very well-respected MDs in very prestigious universities. So they broke some very important ground, and I was very, very fortunate to be mentored by Norm Shealy along the way, who was a neurosurgeon and who was the founder of AMHA, which is American Medical Association Holistic, and that's the word we were coming to a minute ago. And to circle back to your question, Daria, I had another interview in which I was asked this question: what is energy medicine? And instead of my version, I thought I would ask Dr. Shealy. After all, he's the grandfather of holistic medicine in the U.S. And interestingly enough, and I think it's interesting to share this here, is he says energy medicine is all therapies, is all of it, including what we consider as conventional medicine. And I think we would probably add, and Norm would probably add, that would probably also mean nutraceuticals, et cetera, right? So I subsequently began having a practice in energy medicine that I realized was moving more towards the intuitive end, and was really privileged to work with a lot of fine folks along the way. So my practice is, I'm a medical intuitive, and my practice is in energy medicine. And I really enjoy working with all kinds of people, spectrum from the first part of life, which means in utero with pregnant moms, to end of life.
Okay, thank you. Ashley, how about you?
Well, I consider myself an extrasensory person. So growing up, I've always just been extremely sensitive, and I had chronic fear growing up. So my life was really great. Everything was, wonderful, family, all that good stuff. Yet at night, I was in a fight or flight mode for a good number of years. So all of my kind of struggles came from within me. It was like everything was great on the outside, not perfect, but everything was pretty great, and everything was coming up from within me. And I tried, medications, therapy, all of these different modalities, and Western medicine failed me a little bit. I was very sick, for a good while mentally, and of course that turned into substance abuse, relationship issues. When that shifted was when I found yoga, and all of a sudden it was like, because my body was so separate from my mind, was so separate from my emotions, I was fragmented. And yoga gave me my first experience of integration, which is energetic medicine, I believe, is bringing everything together, a state of wholeness from the inside out. And from there, I had an awakening. It was like, it's time for you to remember who you are. It was just this big, wow, I've never felt this deeply connected to myself. And then I just dove into Reiki, using these practices as a way to not live in fear, to not live in depression, and to create my dreams. And I started to practice Emerald Healing Arts a couple years back, and I love it, everything about it. So I feel very liberated from doing this work.
Excellent. Helene?
So I started my journey as a young person. I had a near-death experience when I was very young as a result of a fall. And it was something I hadn't integrated for a very long time. It kind of came up during a process of therapy. But in adolescence, I had something like what you were talking about, Veronica. Some kind of intuitive part of myself came online, and I had an out-of-body experience where I helped someone who had been killed in an automobile accident near my home. And at first I didn't believe it. I didn't know what was going on. I didn't have anyone to speak to about it. It was really out of context, and I really doubted my perceptions, like what I had experienced, even though it was extremely clear to me and still is. And I found, to your point about Western medicine and complementary or holistic medicine, I found the proof a few days later that there had been an accident, someone had passed, it was the person who I had assisted. And so it was kind of a beginning of a journey, but a kind of fragmented journey. I didn't really pick up my intuitive self or a kind of a greater awareness of myself until I was much more of an adult and started a psychotherapy course. What I mean is I underwent psychotherapy for a variety of things. And then I became very interested in psychology, in what one of my teachers, Arnold Mindell, calls rainbow medicine, which is kind of an amalgam of Western medicine, Eastern medicine, energy work, all kinds of things, psychological work. So my tendency is to work in a psychological and spiritual way with people. So I've had a lot of trainings of various kinds. They're all wonderful. And I think it speaks to the kind of spectrum. You were talking about the light spectrum earlier. Energetic work is a spectrum of experience, a spectrum of people being skilled in a variety of areas. So what I find that I am most helpful in doing is using my experience with psychology, spirituality, trauma work, and working with people who can benefit from a kind of a different way of weaving those things together.
Well, I too have had my own experiences, which is not, I feel like, and from the I remember 5 years old having experiences, and I feel like the more you listen to that small voice or those yearnings or whatever it is you want to call it, the voice, that says, don't do this, do this. And the more you listen, the louder it gets, and the more you are guided to other kinds of things as well. And so I can remember a day laying on the acupuncture table and not realizing my whatever you want to call it, etheric body was separated from my physical body. She gave me an acupuncture treatment, and I literally saw that was separate from me, and it came right into me, and I was like, what? And so when you have these experiences, you go and research, and you go, okay, what is this? And which leads you to something else, and something else, and something else. But, for a lot of people who are listening to this, it sounds, well, Western medicine is all about being able to test and diagnose and categorize and compartmentalize and label and all those kinds of things so people can understand what it is we're talking about, because a lot of this is kind of airy-fairy stuff for a lot of people. And so how, can you give me an example? I mean, you've all given me personal examples and things like that. So, but can you give me an example of a person who's come to you for whatever it is that you do, for whatever help that it is that you impart to people? Give us a concrete example of what it was that the person that had, and briefly, because we want to get around to all of you, and then what did you do to help them? Who would like to start?
I can start.
Go ahead.
I had an experience. It was actually with a colleague, and so I'll use that experience. He is a master hypnotist, and he teaches hypnosis all over the world, he and his partner. And he came up to me at a trade fair where I was doing a nutritional booth, and he said, I need some information from you, because I'm also a hypnotist. And he said, I'm at this level in my work, and I can't get past this. I feel stuck. And he said, if anybody can help me, I think you can. And I'm like sitting there going, well, I'm not sure he needs nutrition, And I said, well, just let me think about this, and then I'll get back to you. Well, the next morning in the shower, I was taking a shower, getting ready to go back to my business, and I hear this voice. He was stuck in the birth canal for hours. Do rebirthing and he'll be free.
Okay.
And so I went and looked for him, found his booth, and I said, I have some information to share with you, and you can take this and use it, or you can just say it doesn't apply, whatever you want to do, but this came to me and I just wanted to share it. So I told him, and he goes, that's interesting. My mother told me it was a very difficult delivery. He said, so I'm going to do this, and I'll let you know. And this has been about 10 years ago. And he is doing phenomenal. He did rebirthing.
Excellent.
He removed these stuck feelings, which was a ceiling in his life. And he's just going on and writing and teaching and doing a great job.
Fabulous story.
I get emails from him saying, thank you again. And this has been years ago.
And see, this is the whole point. We don't always have the technique for a person, but we get, and there's a vast variety of alternative therapies. There's Reiki, there's acupuncture, there's massage, there's, yoga, there's all kinds of things. And so, we all can't have the expertise for all of those things. And so, the great part of most of the people who do this work is the collaborative effort, not just with other practitioners like ourselves, but also with working with the medical profession, because I find it really important. Sometimes a medical professional will do a test and find out something, and then the person will come to alternative medicine rather than taking prescription drugs or other kinds of things. So anybody else have an example?
Just on that note, this was quite some time ago. I was quite early in my work. A doctor referred a patient to me who was in his 40s at the time, very active, went to the gym and all that, and had an ankle injury that wasn't healing, wasn't responding to PT, etc. And he was very new to the idea of any sort of holistic practice or energy work, but very open. I put my hands on his ankle, and after we had had a conversation together, and I said, "What happened when you were 20?" And he just started tearing, and he said, "I had been training and training and training for this marathon. I was in college, and this was not a runner's body. So he had, he had some challenges to overcome just to really be able to participate in this marathon." And sure enough, he said as soon as he stepped off the curb to get into the lane, he severely injured that ankle. And then I said, "I'm just wondering what happened to you the night before." And he said, "My girlfriend broke up with me." Everything that's ever happened to us, I assert, every thought, every experience is in there somewhere, and unprocessed trauma has an amazing effect and throughout our life. This man then was in his 40s. We went through the history of how many times he had injured the same ankle, right? And the other interesting thing we explored eventually was that all of his subsequent relationships ended up being very much based on that rejection. It completely, he went on a complete journey of healing and spiritual exploration. He went back to his PT. He started getting better right away. He went back to the gym right away. And what was really interesting is I got to meet up with him 10 or 15 years later. And he was in a new relationship with a very healthy relationship and a wonderful woman, and had never re-injured that same ankle.
Ashley, this is like the point you were talking about in terms of root causes of
Exactly.
things. And the thing about the difference between energetic medicine is that it looks for root causes rather than treating whatever the current symptoms are. And I think that's a huge difference with energy medicine versus traditional medicine that's invasive, and whether it's drugs or surgery or those kinds of things. But we come from a culture now who wants quick fixes instantly, and energy medicine is oftentimes a slow process because when you try to get to the root of something, it often takes time. It doesn't come instantly to you all the time. So roots, getting to the root of things is really important. Do you have a situation?
Sure, yeah. What comes to mind for me is I've had two friends who specifically knew that they were a little closed off, a little skeptical, and of course, that showed up as being really tired in life, just symptoms of, exhaustion and not having this beautiful experience with life, a little closed off, but they're really open, to Reiki on some level. So they come to me and get on the table, and immediately one person in particular, her whole energy was like, "Don't come near me." It was completely shut off. So you can imagine how there was just no life force, being able to move through her, which, we know that when we're low on energy, dis-ease takes form. Whether mental, physical, spiritual, there is a dis-ease, and you can feel that. It feels like an imbalance. And so for me, that showed up as, "Don't touch me." So of course, honoring that, working, above her body and in the energy world, and just really in that moment inviting in a lot of safety, because you can tell, their fight or flight response is activated. I wasn't aware exactly of what trauma was there. A lot of the times I don't get specific messages about specific experiences that they've had. It's more of an overall emotional imprint. So love is not safe.
Right.
And then the whole energy system shuts down.
Right.
And then they're not receiving. They're
Right.
tired. And so honoring that and just working with them has enabled these clients to receive from life and just create this beautiful relationship, give and take, and enjoying life, because we really want to enjoy life and have that, you know, relationship where we're giving and receiving. So that's been really interesting.
So you built a trust with the people in order for them to be able to open up.
Sure.
And this is what I have to do with my autistic clients all the time, because they've been, most of the time I get them as older adults, and they've been traumatized from the medical profession as well as, you know, in school and everything else. And so, you know, there's the lack of trust there. And so you have to build up that trust in order for them to be able to, you were going to say something?
No, just it's a great example of then your client can also really move to the point where they can receive and be open to your energy work first. And that's just, you know, such an important experience for them that they can then translate into their lives. Yeah. Great
Ellen,
story.
did you have
Absolutely.
Did you have a?
Yeah, I wanted to speak to a couple of things that you've brought up. One of them is the kind of the feeling that what can't be seen, the energy world, is not valid.
Right.
And I have a particular interest in working with groups and working at a distance, because this information field that we are interacting with when we work with our clients is, yes, it's around their physical body, but it's also a field of information that's connected on a larger scale. And so recently I was asked to work on 3 preemies who were not in my presence, and about whom I knew very little, almost nothing. And so the way I do that is I go in through Reiki, and I connect with I guess what I would call a quantum energy field, and connected to the babies. And I was really surprised, and the other reason I'm bringing this story up is to underline feedback, because feedback is really important, especially when you're working in the subtle level of the energy field. Sometimes in Western medicine there's a machine that provides feedback to you, whether it's an X-ray machine or a stethoscope or something like that. But in the subtle realms, the feedback is from the person and from their energy field to your energy field. And so I shared my impressions of the session with the person who'd asked me to work on them. And I also want to say that when you're doing that kind of work, there's always permission that needs to be obtained.
Oh, yeah.
And that's permission from a different level of the self, kind of the big S self instead of the small s self. And I was really pleasantly, I guess, surprised and really reaffirmed by the things that I understood from my session at a distance. Some physical things that I noticed were confirmed for me through the person, and also some more subtle things about family dynamics and about spiritual connections and kind of the why something might happen, which I think everyone, you've alluded to it, Ashley, and you too, Veronica, so what is this cause? And why is it important to track the cause as we move through life? Because my feeling is that there is a force that is moving us through life, and perhaps the reason for encountering certain things is part of what is moving us through. So rather than think of something as, oh, this is a terrible thing that happened, it's what is the larger picture with this cause? And so that's also part of what I picked up with these little ones and the family. And I'm happy to say they are at home now and doing really well.
Oh, sweet. Great story.
So I also want to say that because I think a lot of people who doubt either the efficacy of energy medicine or the legitimacy of it think that it's some kind of con. And I want to bring that out because
That was one of my next conversations to
Yeah.
talk about, because people who come to us who are ill or have exhausted all kinds of other modalities and things like that, they're vulnerable, and they are in need of help, and they're just, all they want to do is feel better or not be sick or whatever it is happening to them. And one of the things about being vulnerable is that it leads to people who are predators as well, who are out there. And one of my questions was, we're talking about all these things, but how does a person know who to go to, who is ethical? And I will tell you that I did a little bit of research myself when I had cancer, and what I did was people were talking about muscle testing, to determine what illnesses are and things like that. And I went to 10 different people to ask them to have muscle testing, and not one of them picked out anything that was wrong with me. And it made me think about, well, how do I know who to go to, and what is it, because allopathic medicine, as you said, can be measured, and I can look at an X-ray, and I can look at a MRI imaging, and I can look at all those things and know physiological things that are wrong. But when it comes to our energy fields, there are techniques that are used, but how do you know?
I think regardless, one of the things, I think there's been research on this, but even with allopathic medicine or with rainbow medicine, if you want to push all of it together, the most important interaction is between you and the provider. Whether you're working psychologically with someone, whether you're working with your surgeon or your primary care physician.
But my question is, how do you know that person, because as a therapist, like I have stopped doing that and send my people to, because
well, there are a variety of ways.
But what I'm saying to you is, it's important to, and we all share, and give each other, when we don't know something, we send it to somebody else and things like that. How do you determine, and how does the person figure out the right person to go to in order, what kind of measurement is there where there is in regular medicine? So,
Well, we're dealing with physics.
okay,
So when you go to regular medicine, you get chemistry. You get
Okay.
the chemistry of the body. It's organic. It's tangible. You can touch it.
right,
Then we're going to move into the spectrums we were talking about. That is, actually, it's quantum physics.
okay,
And I had my 10-year-old grandson explain to me quantum entanglement recently, and I went, now I get it.
okay,
Because it was like kind of out there in the mysteries. But most of my clients come by referral.
okay,
And they trust the person that refers them. And in the first session, a 2-hour session with them, they know if we're a match. They'll either come back or I will refer them if we're not. I think the important thing as knowing if the person is an authentic energy healer is how does that person take care of themselves? What do I do before I put my feels next to theirs? Well, first of all, I meditate. I call in divine interference with me if I need it. I want my garbage, so to speak, left outside the door, so I'm not bringing that in to affect their feel, because my attitude, my words can all affect their feel as well. So if you went to 10 muscle testers, you may have gotten 10 different things. Right.
right.
I'm with Ashley, and as you guys have spoken, I look for causes.
What do you mean
do
causes?
Timelines. What happened
Source,
when?
right.
Sources. What is, I've been treated, say, Lyme's disease. I've been treated for 3 years for Lyme's disease. I'm financially broke, and I still have Lyme's disease. So I look at those blueprints.
That's
What are the
actually called,
blueprints?
it's called something, which is what I practice, fundamental medicine it's called.
Right. It's the old medicine.
Right.
Yeah. And until that blueprint is removed, generally they don't get well.
Right.
And I say that because if you look at a blueprint of a house, if the house burns down and you have the blueprint, you can build it back identical.
Right. Right.
And that's what the body does.
Okay.
It will build that disease back identical because it's an interference. And it gets used to that interference. And it gets a lot of attention from family members around that interference. Rightfully so. If you have a sick family member, I nurse them because I was a nurse. So that can actually interfere with healing sometimes. So I generally end up seeing the whole family for really chronic, long-term illnesses.
Yep. You have to deal with the whole family in order to
Yeah, I worked
change.
a little bit with Deepak Chopra. And he said that he would have women come to him with breast cancer, stage 4. 6 months later, they were clear. He'd send them home, and 3 months later, it had reoccurred.
Yep.
Because the family did not believe they had been healed.
And the imprints were still.
And the imprints.
And the same thing
Absolutely.
holds true for, in medicine, when they remove the cancer, they really haven't gotten to the root of it. And it may not show up in the same place, but it shows up somewhere else because
Exactly.
the root of whatever it was not removed. And so, exactly.
And different modalities will talk about blueprints in different ways. Some people will talk literally about a blueprint, and practitioners will perceive them in different ways. And I think part of your question is that as the seeker, as the person who's looking for healing, you have to be engaged.
Yep.
It's not a passive exercise. And so I don't want to take anything away from practitioners to be clean in their practice, to be ethical, to do their inner work, to kind of set the stage for a session. But as the person who's looking to find the cause, you also have to be, there has to be an engagement. And I think it's really important, even when you're working with someone who you've taken on as a client, often someone will not be ready. They will not, they cannot engage. They look to you for the healing.
Or for the answers, which is,
The answers.
and really our job is to empower them.
Yeah.
So to your question earlier, Daria, that yes, you go to a practitioner at a time when you as the patient or client is in a very vulnerable state. My job is to empower the person I'm working with to really elicit their own innate healing response, not to do something to them. In that process, they are accessing their own inner wisdom in a way that then empowers their journey further. It may be me, we may be a match, or it may be another type of practitioner, but they grow into being more in their body, being more in touch with themselves, and we're here to more activate, if you will, their own innate healing ability, rather than to fix something or impose.
Right.
And to your point, I don't know how many times people have come to me and they immediately say, oh, you must be Reiki, or you must be Barbara Brenner, you must do this, or you must do that. And I say, no, I have one job, and that is to show up. I have one job. I am not a formula girl, and I will never be a formula girl. I have that one job, and that is to be in that clean space, if you will, from your language, and to be present to you at your time in this time of your journey.
I think that's really important, the presence. I have spoken, friends, I'm sure all of us know someone who's gone and they don't feel heard. They don't feel that the person that they're engaging with on their healing journey, whatever that is present for them.
Right.
And I think that's really, really important.
Or that they use, or the practitioner uses a system. You know, we have to do this first. We have to talk about when you're 3 first. Well, no, that might be very, very destabilizing for a patient. Let them, honor their body's own intelligence is my number one. Honor their body's intelligence. Allow them and empower them to take it in their own way and time.
And that's the value of experience. This is wise women.
Right.
And I think there's a lot of wisdom at this table. And that experience is something that we all have in different ways. I think there are wonderful systems out there. We've all been to classes and trainings, and we continue to train ourselves from our experience with our clients. But I've noticed, at least in myself, speaking personally, that whenever there's a new training for me, I have to take it in, and I have to wrestle with it, and I have to see how it fits with who I am and who I'm progressing toward being. And I think that's
And not just having another label after your name.
Yeah,
Right,
exactly.
right.
And that it really is you, and that it's going to work with your population.
So I want to summarize a lot of the things that you've said. So because I think many people may have missed it is as part of the conversation, but not only your personal belief, but the people who are surrounding you to be believing in whatever the process is that you're going through. Number two, the helpfulness of voicing to someone in order to be able to be, we can't open our mouth and look inside and, see what's going on in there. But as we vocalize and as we voice, and if we've got somebody there who hears and listens, we're able to work things out ourselves. And you also talked about taking the time. Well, the problem with this Western medicine now is, 15 minutes you're in and out. What are the points you want to talk about? Whereas in what we're talking about here, we take the time, we find out, we do a family history, we do, all kinds of things, learning about your personal history and those of that nature. Then also you talk about honoring themselves and their own body intelligence. And most people go to specialists because they don't honor, their own, about themselves. And for the practitioner to keep on learning, and I think it's really important when you go to somebody who is not just keep on learning about whatever it is that they do and different techniques and things of that nature, but also learning about themselves and working through their own things.
Must.
Yeah.
So,
But Daria, in a comment to that, I feel like a doctor who has themselves for a patient has a fool for a patient. So I seek other practitioners to assist me.
yes,
I mean, I know
that's what I
quite a
meant.
bit about my own self,
Yep.
but then when I hit that wall that's just like I'm blinded, I seek someone else because I'm not going to try to work this out completely if I've hit a wall. And if I don't work that out with someone that I trust, I can't service and help render service to the people that come into me.
And do you find when you work on an issue with yourself that you're processing something about yourself, all of a sudden you've got clients who are working on
Absolutely.
All the time.
Yeah.
Shows up in that
Absolutely.
chair across the room.
I call that the universal guides. Send them to us. Once we've handled it, they go, okay.
Oh, that one has my name on it.
Because once you learn it yourself, the best way to integrate it is to teach it to somebody else.
Exactly.
And I want to bring something else in, since we're talking, we're in our Western culture, and we're talking about regular medicine, and the issue of cost comes in. And I think it's important to touch on that. Most of us probably, unless there's some way we can be covered by insurance, are not covered by insurance.
Yep.
Right.
So people are going to pay out of pocket, which makes the kind of synergy between you and the client or patient even more important.
Excellent point.
But I think there are also things that a client can look for. Are there other ways that the practitioner can accommodate them? Is there a sliding scale?
Right.
Is there some kind of clinic where they kind of gather people together? Is there some kind of training you can do with them, even just as a basic introduction?
And in Charlottesville, we have common grounds to refer people to, and other wonderful collaboratives that offer services to the community.
I want to kind of move to a different area here, because it's so prevalent in our culture right now that, these energies are so subtle and so vulnerable to environment and all these other kinds of things. What about, people who consume a lot of sugar, do drugs, prescription or otherwise? But now we've got people who are implanting technology under their skin, body modification all over the place. Do you feel like that affects people's energetic fields, and in what way?
Especially antidepressants, especially SSRIs.
Okay. And so, but how about everywhere I go, people have tattoos.
Well, I think the tattoos is a huge one, but the body piercing is even more devastating because a lot of these body piercings are in the Chinese meridian lines.
Right.
So they're actually cutting off energy in their body. That subtle energy, it has to figure out how it's going to reroute itself. Energy does a good job of rerouting, but after so many tattoos and so many piercings, it's confused at that point. The new tattoo inks aren't as caustic as the old inks, which had lead in them, but they're still, it's not my favorite thing to advise people to go out and do, to get a tattoo or a piercing, and especially when you look at tongue piercings, when you look at navel piercings and things like
All the
that.
meridians. Yep.
Yeah, right, all meridians.
The other thing that is sometimes really hard to discern is when you're really looking at a constellation of symptoms that somehow or another, no matter what you do, don't make sense. And you look into those environmental and you go, oh, what does your bedroom look like?
Right.
How many do you have a cordless landline in your? Do you have the iPad and the iPhone in your bedroom? Do you have the TV? And all of a sudden, there are new answers that that no doctor probably would maybe think about going there. And it's more and more prevalent. More and more people are living in large apartment and condominium buildings that they can't possibly get away from, or even make a safe space for them to sleep in.
Well, I know that true. I mean, I just recently had a client who all of a sudden had all these severe allergy problems, was getting shots and things of that nature. And I sat down and talked with him and I said, what are you doing differently? And he said, well, I'm not really doing anything different except, I'm spraying the lawn with Roundup. And I went, bingo, But how many times does, the practitioner, but I also want to talk about, I saw a show the other day that actually freaked me out with somebody putting, they had technology so they could open their door, so that they could, turn on their phone, so that they could do all kinds of things, open their car. And I thought, oh my gosh, it's really, I thought it was bad when they were putting plates in people for broken bones and things, and here we are now, so people's energies between all the things that are going on in the environment, energetic work seems to be much now even more important than ever before with all the bombardment that's going on.
And when you talk about the environment, there is the environment of the world. I mean, we're on a quantum level, we are connected to the planet, to the people in the planet, to the energies around, to the things that show up societally, and to how we interact with those energies. And if they are kind of part of our shadow world and we have not addressed that, then it becomes important that people will come in and they'll say, oh, I can't stand this or that about our culture at the moment, or how it's been developing. Look at all of this technology. Well, there's a bigger question to that. So how is our world evolving? How are we evolving with it?
Yeah, exactly.
I'm very interested in that, and I have done some research on how to measure the field interactions between individuals and groups and the larger world. And there is actually something called the Consciousness Project, which I won't go into detail because I don't think we have the time, but I'll leave the information with you in case you want to put it in show notes, where it's a way of measuring how the group consciousness and the individual consciousness intersect and amplify one
remember
another.
studying that many years ago.
And
Connie.
Daria, you said something very important just there, and that is just how important this kind of work, and that we're exploring other ways. Not that we eschew traditional medicine, that we work alongside of that, but in our very chaotic world and our increased technology, it's even more important. And being imbalanced. And we see over and over again people who are being so triggered by what's happening in the world, what's happening politically, what's happening environmentally. So
That's actually going to be one of my next shows is how the political environment is affecting us health-wise through an astrological
Not
kind
well.
of perspective.
Wow.
It's the short answer.
Yes, and I
It's
agree.
it's a bit of a journey.
And so, these are the kinds of things we need to really talk about in terms of, where we're going with our technology. Technology in absolutely, but I really appreciate you ladies coming. Thank you. And it was a fantastic panel. You all are very brilliant and wonderful, do wonderful, wonderful work.
Thank you.
And it's a real privilege to be able to know all of you. And well, we would like to thank you for joining us. I'm Dr. Daria Brzezinski. You've been watching What Wise Women Want. And today we were talking about bioenergetic energy. And please join us again for very interesting topics. And go to our website, whatwisewomenwant.com. And remember, Wise is spelled with a Z. And thank you, and we'll see you again next week. Goodbye.